We continue our talk today on men's health with another special guest, Mayor Emeritus Sylvester Turner. As a kid with very limited means in the 1960s, Sylvester Turner walked downtown looking up at the tall buildings and building and dreaming of success. 50 years later, he became mayor of the nation's fourth largest city, serving 2 terms. He knows Houston is a place where if you can dream it, you can do it. Sylvester Turner's story began in the Acres Homes community in Northwest Houston, where he was born and raised as one of 9 children in a 2-bedroom home. Sylvester's mother worked as a maid in the old Rice Hotel in Houston. His father worked as a painter for Continental Insco, and on the weekends, cut yards with his sons to make extra money. Sylvester lost his father to cancer when he was 13 years old. With the help of his family, pastors, and teachers, he went on to attend the University of Houston and Harvard Law School before joining the law firm of Fulbright and Jaworski. He later founded the Houston law firm of Barnes and Turner in 1983. In 1988, Sylvester was elected to the Texas House of Representatives to serve the people of House District 139 in Harris County. In 2015, he was elected as the 62nd mayor of Houston and was re-elected for a second term in 2019. Before we start the final piece of our conversation today, we are joined by another special guest, especially of the university, President Reginald DesRoches. He's Rice University's 8th president. He also serves as a professor of civil and environmental engineering and professor of mechanical engineering. As president, he is the chief executive officer of the university and its 8,600 plus students, 8 schools, and more than 900 faculty. He previously served as Rice's Howard Hughes Provost and William and Stephanie Sick Dean of Engineering. Before his appointment at Rice, he served as chair of the School of Civil and Environmental Engineering at Georgia Tech in Atlanta. His top priorities are to enable Rice to reach a new level of distinction nationally and internationally for world-class teaching, impactful research, award-winning scholarship, and insightful creative work. He's a member of the prestigious National Academy of Engineering, American Academy of Arts and Sciences, Philosophical Society of Texas, and is a fellow of American Society of Civil Engineers and the Structural Engineering Institute. He's also a member of the Academy of Distinguished Alumni in Civil Engineering at his alma mater, Berkeley, and was named an honorary alumnus of Georgia Tech. DesRoches was born in Port-au-Prince, Haiti, and grew up in Queens, New York. He earned his Bachelor of Science in Mechanical Engineering, a Master of Science in Civil Engineering, and a Doctorate in Structural Engineering at the University of California, Berkeley. He's married to Paula, a highly accomplished healthcare professional, nurse practitioner, and administrator recognized for her leadership in occupational health. They have 3 children, Andrew, Jacob, and Shelby, who graduated from Rice in 2023. Mr. President, welcome to the conversation.
Thank you for having me.
We just heard about Mayor Sylvester Turner's journey, his health journey. So let's start with yours. This is the first time that you've actually talked about this for quite a while. What was the thing that really changed your life and the trajectory, and what did you deal with in particular?
You know, I've been very judicious about going to the doctor every year, probably because my brother's a doctor, my mother's a nurse, my wife, as you mentioned, is a healthcare professional. And so I would always go and check my numbers, and I noticed that my PSA numbers were creeping up. And I knew what that meant. And so got to a point and went from 1.5 to 2 to 2.5 to 3.5. And I went to the doctor and said, hey, should I be concerned about this? He said, well, that's getting high, but probably you're okay. I said, yeah, actually, I think I want to get a biopsy. And so the first lesson is, advocate for yourself. And so he did a biopsy, and it came back positive, to my surprise. And so at that point, I realized I needed to do something. I went and saw a specialist, and they confirmed. And they confirmed, fortunately for me, it was very early stage prostate cancer, stage 1. And I had a choice of do nothing, do surgery or radiation. And obviously had lots of discussions with my family, and ended up deciding to do something about it. It was so slow growing, they thought I could wait a year or more. I decided I didn't feel comfortable having this cancer in me, and so I decided to go ahead and have surgery and remove the prostate, which was the best prognosis for me, given it was very localized. So I went through that process. I had to decide when to do it. This was in my first year of the presidency.
Wow.
At Rice. I had found out literally a few months after I started in the role, and my inauguration was coming up about a month later after I found out. So I had to decide how I was going to time all this. Ended up waiting until after the inauguration to do it. The timing worked out well. It was a very, very busy first year. I knew I'd have a little bit of downtime with Thanksgiving coming up and then Christmas. And I was motivated to do the marathon that following January, so I decided to do it right after the inauguration, which would have been early November, and got it out the way. I was able to have a little bit of a break between Thanksgiving and Christmas to really recover. And I did the marathon in January, and I was very pleased that I ended up getting it done and not waiting till the summertime, because I really thought about waiting till the summertime to have it done.
And so how do you feel now? How are things now?
I feel great. I get tested every 6 months. I've been zero PSA, cancer-free, and I feel great right now.
The both of you are in highly visible leadership roles. You just said that you mentioned this right before a break. I read that you sent a memo to everyone right before break, so it's on their mind. You are anxious to lead this university, and you get hit with this. How did that impact your leadership?
Yeah, I don't think it did impact the leadership. I was struggling with whether or not to say anything. This is the first time I had such a private issue occur in my presidency, and whether to be public about it. So I talked to a number of people, a number of my mentors, including Ruth Simmons, to get advice on should I not mention this, and I can probably have the surgery, nobody would know. And she said, absolutely not. She said, you need to mention this, you need to control the message, and you need to be transparent about it. And control the narrative is what she kept saying. And so, when Ruth says something, you listen.
Sure.
And so she's been a great friend and mentor. So I decided, okay, I was going to do this, and I made sure I communicated. First, I told a number of individuals, obviously my family first, and the board of trustees, and my deans and vice presidents, and then I crafted a message to go out to the community that really spoke about how I found out and the lessons I learned, and how I was early stage, and I felt I was going to be okay.
Mayor, I'll throw you in on this. You said that you were always busy prior to the diagnosis. You were busy after. How did your administration respond to that, to knowing that you needed to keep your health a priority, but you also needed to serve the city as well?
Well, they responded well. Quite frankly, nothing changed. I was out for that 2.5, 3 weeks, but that was during a period of time when, 4th of July, for example, and I was scheduled to be on vacation anyway. So things kept moving forward. I had some key department heads that would come by the house if I needed to know anything or they needed to see during that 3 weeks. And then when I returned on July the 18th, we moved forward. Even when I went through radiation, I was finished by 8 o'clock. And I was right back at City Hall. So nothing changed. I told my scheduling people, everything remained on the calendar. The speaking engagements, the lunches, meeting with the press, nothing changed. The only thing that sometimes happened, and sometimes meeting with the press, they would irritate me a little bit more than in the past. Because when you're dealing with something,
sure,
and people don't know your story, and then, if you ask me something that didn't make sense, my patience was not as strong. And I wanted to tell them, damn it, I done gone through surgery and radiation. I ain't got time for no foolishness right now. And that happened one time when I really, and then my chief of staff who knew said, okay, settle down. And but in terms of the directors, in terms of the employees, it was business as usual.
Was that a tricky thing for you to navigate as well? Being in leadership, making those executive decisions, people starting to, becoming a little irritable during that time of that diagnosis?
I didn't have that much of an issue just because I was only out. Technically, I was only supposed to be out 1 week. Ended up having some complications from the surgery, which is a whole nother story. But I was out 1 week. I planned to be out 1 week. Everybody knew I was out 1 week. I was able to maintain some business via Zoom, and so it wasn't as if there was any disruption from that perspective. So I was able to maintain pretty smooth continuity during the time that I was out.
Wow. You come from humble beginnings, immigrant parents. I would imagine that there's some pride that comes along with being in that type of household. Did you find yourself at any time being afraid or wanting to keep kind of a cloak on what was going on with you, or moving as if nothing was going on with you?
It wasn't so much afraid. I just, I wasn't used to being public with private information, and I didn't realize that now. And I was told, people told me, you're in a public role. You need to disclose this. It's not, you can't just think about yourself in this fashion. That was new for me because I was a new leader and new in terms of being my public image. And so it wasn't a pride thing. It was just, I wasn't used to really being out there about personal issues like this.
What about you, Mayor? Same question.
Same thing. I knew at some point I needed to talk about it. And in fact, it was during my State of the City when we were talking about resilience. And it was one thing to be talking about storms and COVID. And then right during the interview time, something hit me and said, a part of leading is letting people know what you personally face. And so it was during that State of the City in September that I decided it was the appropriate time for me to disclose. And I agree with what Reggie said, President said, is that your life is not just, it's public and private. And it's better to control your narrative. And I thought that was the right time to tell my story, control the narrative. I picked the time and the way it was going to be presented. And I wanted to do it in such a way that my story, I thought, would resonate with many others who were facing similar circumstances or might be facing similar circumstances. So I decided to talk about it.
How big of a role did your own community play in your recovery? Your immediate family, your friends, your confidants, how big of a difference did that make for you? Because some people who go through these health issues don't have that tribe. So how was it for you?
It was huge. Obviously, my immediate family, my wife who's in healthcare, she took care of me obviously that week afterwards, and she knew everything about what was going on. And when I had the bandages on,
yeah, I mean, you know the terms.
Yeah,
PSA
no, I knew the terms.
I don't know what that means,
so
but
she was always there. I had ended up having an infection afterwards, and she was right there to help me sort of navigate the complexities of that. And then obviously the community came through. I mean, I was just amazed at how many people I heard from afterwards, praying for me, thinking about me, and thanking me for sharing my message. I didn't expect that. I mean, I expected people to say, we're happy to hear you're doing well, but people thanked me because they had a similar situation and they felt now that they can talk about their story, and that's something I wasn't expecting. Or in some cases, people said, I haven't been to the doctor in 5 years. I'm gonna go get my PSA check next week. And I'm a 50-year-old black male. And so that I wasn't expecting. When I sent the message, that wasn't the intention, but certainly that ended up happening quite a bit.
Wow. What about you, Mayor? Same question.
Well, 2 of my sisters are registered nurses. So that was of tremendous help. But there was not a day when I was in the hospital that one of my sisters or my daughter, they were with me around the clock. So that helped. And then when I came home, they were right there. So that support sector element was there. The other thing too, my dad died of cancer when I was 13. But my situation and my care was so different from my father. Because when my father died, we didn't have private health insurance. He didn't have that. My dad had painkillers. And my dad just decided to work until the good Lord called him home. So that too played in my head. And for me, it was like maintain a positive attitude. So blessed to have the care that I needed and the support that I needed. And that was a critical part of me moving forward.
What advice would you have for young men, young black men, closer to my age? I'll be 40 in a month. I'm in the age of, black don't crack. Like, opposite of what the commissioner said. But I'm in that age where I may not have as many complications on a daily, but things are just starting to change a bit. Knees don't work the same. Starting to notice that I need to pay more attention to my health, but not quite to the point where I'm proactive about it. And I'm going to the doctor every year, and I'm getting those checkups. What advice would you have for men in that age range who are starting to see things a little differently?
I mean, you just said it, go to the doctor every
Yeah.
year. You know your body better than anybody
Yeah.
else. After I had this infection, I told the doctors, this doesn't feel right. They said, well, you're probably okay, just let it go. And I said, you know what, this doesn't feel right. I'm gonna come back in. And it ended up, I did have an infection. If I hadn't gone back in, this is a week after the surgery, I would have been in a serious problem. So you know your body better than anybody else. And you have to be an advocate for yourself. I mean, you absolutely have to push hard and say, you know what, I want that extra test. I want a biopsy. I need to have that for my peace of mind. And you have to be an advocate, and we don't do that as much as we should.
And what I would say, treat your body better than you treat your car. The reality is that if we hear something wrong with our car, we'll go check it out. If the tire pressure is low, you check it out. Treat your body better than you treat your car. And then don't be selfish. It's not just you. It could be your spouse, it could be your children, it could be your family. So don't be selfish. And don't assume that it's just going to magically go away. If your body is talking to you, listen to it. And it will talk to you louder and louder and louder. If it gets to the point where it's screaming to you, it may be too late. So while you hear the whisper, respond to it. And then I'm just someone who believes God sends you signs along the way. And for me, he knew I wanted to go to France. In fact, I was supposed to bring that with you.
Supposed to be with me, exactly.
I was supposed to, that's where I was going.
That's right. That's right.
So he knew I wanted to go on that trip. And that was enough to get me to the doctor. And then from that, everything else was discovered.
Right.
And the other thing I'd say, just to completely
Sure.
be honest, one of the mistakes I made, I think I handled this really well, is I didn't tell my father. 91 years old in an assisted living here. I said, he'll never find out. He's sort of removed from the community.
Oh.
And I walk
No,
into,
Dad found
I
out.
walk into his room a week afterwards, and he had the newspaper, because it was in the Chronicle, the Houston Chronicle. And he had the newspaper. And all he did was look, why didn't you tell me? And your sister and brothers didn't tell me either. And so that was a mistake that I made. And my wife said, tell your dad. I said, he'll never find out. Oh, he found out.
Dads
all right.
always find
And
out.
Dad was not happy.
All right. Well, I will check my body and my car after this conversation. Mayor Emeritus Sylvester Turner, President DesRoches, thank you very much for the conversation.